So our next follow-up session, you brought the MRI report, and I started reading through it, and it clicked in my head that it wasn't a meniscal tear, right? It was just the simple fact that you were putting so much load on your body. You were so focused on pushing weight and not correct form, proper muscle recruitment, that we had a patella issue, right? Your knee alignment wasn't proper, and you were getting this medial pain that kind of mimicked the diagnosis or the symptomology of a meniscal tear. The MRI report didn't show one, and I showed that to you on that report.
Yeah.
And that's the reality of our medical system, right? They don't take the time to actually dive deep. And if it wasn't for you coming to step into my office, your plans were to push through, get to the show, get on stage, and then go in for a surgical repair.
Yeah.
That could have been detrimental to you down the road.
Mr. Josh, how are you today, sir?
I'm doing good, Stephen. How are you, man?
Good, man. Thank you so much for coming out. It's been a long time to get you on the podcast. You're a busy man, but super pumped to have you here, man.
Yeah, it's been a little bit of a journey to get to this point with, when you started the podcast to get here. Us being both business owners and practice owners, it's been hard to get a time on the schedule. We meet once a week to talk business and shop and family.
Yep.
But it's been a journey to get to this podcast. But I'm excited to kind of go over what we're talking about today. So.
Same, buddy. Same. So if you don't mind, for the folks at home, let them know a little bit about yourself and how you got into physical therapy.
Yeah. So my name is Dr. Josh. I'm the owner of Resiliency Physical Therapy. I own a cash PT practice here in Tampa, Florida. And the way that I've got into physical therapy was through my medical experience from the time that I served in the Navy as a hospital corpsman. I served 8 years, had a bunch of medical knowledge experience, and I wanted to take that and leave a lasting impact in my community, come back home and be able to provide good quality service. Through my time in the military, I found a passion for helping individuals move better, feel stronger, and understand their bodies through CrossFit and Olympic weightlifting. Through coaching, I really enjoyed seeing people's progress from not knowing how to touch a barbell in the first place to PRing their lifts and actually improving and getting stronger, and seeing how much joy that brought them gave me a passion to pursue physical therapy. And through that is where I truly started to love the idea of becoming a physical therapist. And now that I am one, it's amazing to be able to impart all my knowledge and experience, over 17 years of medical knowledge that I've been able to gather and gain. And it's been an awesome journey to become a doctor of physical therapy and open up my own practice and impact so many lives in the community. So
that's awesome.
I'm living my dream.
Yeah, I love it, man. So tell me a little bit about your path to owning your own practice and really what differentiates what you do from other people in the physical therapy field.
Yeah, of course. So when I graduated in 2023, I started to work in a traditional hybrid model practice where it was some insurance like Medicare, TRICARE, some insurances that actually give reimbursement benefits to individuals, and some cash. And through my journey through clinical rotations in school and working in a traditional practice, I realized that there was some faults in the system that really didn't align with my core values and the way that I wanted to treat my patients. So I decided to venture out and open up my own clinic and do things the right way, in the sense that, what I do in my clinic, I get to spend time with each individual, hour-long sessions where I get to tailor the programming for that person that's coming in for whatever it is, if it's pain, discomfort, mobility issues, or just wanting to optimize their performance for the activities that they're doing. And I get to actually take the time to spend with that client. In a traditional practice, it's pretty hard with insurance, the restrictions that they put on the physical therapists, reimbursement rates getting cut every year. It in turn turns the corporate physical therapy clinics to have to increase their productivity standards so that they can meet overhead
Right.
and cover the bills. And that productivity increase in turn goes to the actual doctor of physical therapy, where they're having to see 2 and 3 patients in the same hour that they're
So
there.
patient care just diminishes.
Exactly. So the quality of care kind of drops out, right?
Mm.
A lot of people in the community can kind of probably attest to this if they've ever been to physical therapy, where they go to a traditional practice that they have to wait 2 3 weeks to get a referral, get it in, get seen, and then when they're there, the care kind of looks like a model of, hey, we're going to come get you from the waiting room. We're going to put you on a bike for 10 minutes.
Mm-hmm.
I'm going to grab another client from the waiting room. I'm going to do some manual therapy, maybe give them some exercises, tell them to do 3 sets of whatever, and then walk away from that client to come get you from the bike, go through some manual therapy with you, put you through some exercises while I'm kind of keeping an eye on them, kind of not keeping an eye on them because we're talking, and I'm running you through the educational pieces of what I want you to do, and then kind of walking away from you. So that kind of quality of care in my mind wasn't sufficient for what I wanted to do.
Right.
Right. There's a lot of nuances there that can kind of go wrong. Right.
Right.
You get put on the back burner while I'm working with another patient. You can be doing the exercises incorrectly. The form cannot be adequate for what I want you to do. And then you kind of just feel neglected sometimes,
Right.
where you don't know what you're doing. You get through your exercises, and then you're just kind of sitting there stagnant to get instruction from the physical therapist. And that's kind of when I realized that that's not the kind of quality of care that I wanted to provide to my clients.
Mhm.
So, um, March of 2024, I decided to open up Resiliency Physical Therapy and do it the right way. So give better quality to my patients and get them better quicker because of the dedicated time that I can put into each individual that comes through my doors.
Yeah.
So that's kind of the journey and why I stepped away from traditional practice to do things the right way.
Yeah. And, I think, and we've discussed it at nauseum, but, the private pay model in physical therapy can often save patients money. It's between deductibles and how long you've got to go to a physical therapist because of that diluted treatment versus, cash pay where, you're going to get that person healthier quicker and probably save them a couple dollars.
Yeah, and then that's the reality of it. Most people that call me, they're like, "Oh, do you take my insurance?" And I start diving a little bit deeper. I dig into, what's going on with you first off. Let's not talk about pay. Like, I want to know what's going on. I want to know about you. I want to know what your goals are. Why are you reaching out to physical therapy? What's the outcome that you want? And then I kind of ask them that question. Like, do you know the nuances, or do you know what entails your insurance policy? And a lot of times they don't know.
Yeah.
They don't know about their deductible, how much it is. One, two, they don't know if they have reimbursement
Yeah.
benefits, which is beneficial to know.
Yeah.
Because you can go out of network
Mhm.
to most providers and get reimbursed 50 to 75%, depending on your policy. And then they don't understand that the quality of care, right? It, like you said, they're gonna drag it out. One, two, they're gonna tell you, hey, we need to see you 3 times a week or 2 times a week, and your time is valuable, right? So think about the effort to go to the physical therapy clinic 3 times a week,
Right.
the hour that you're spending taking time off from work or spending time with your family, your kids, the gas mileage, all those things take an effect, right?
Yeah.
They play a factor in the monetary value of you trying to get better.
Yeah.
So with me, I typically see my patients for an hour once a week. I send them home with a home exercise program. And if they're dedicated to that home exercise program, they're going to see the changes in value that I bring to the table. So that the next following week, we're actually progressing and moving forward and not doing the same mundane cookie cutter therapy that you would get typically in a traditional physical therapy
Right.
practice. And I know some people are probably going to see this, and I'm stepping outside of the box and stepping on some toes, but that's the reality of
It
it,
is.
right?
Yeah.
Our healthcare system is flawed.
Yep.
Our insurance is a gambit, and I want to be able to bring a higher quality of care to physical therapy and change the outlook of what people think physical therapy is.
Yeah.
So,
You know, I'll share a personal experience, and really one where you and I got to know each other was last year. I was in prep for a show, and you know, I'll start off by saying I'm a very stubborn person. You know this about me, so I'll push through most injuries, and that's probably not what a physical therapist wants to hear. But I pushed through a knee injury that then turned into a hip injury that eventually led into a back injury that debilitated me. I was, you know, pretty much bedridden. My wife was like putting my socks and shoes on, and you know, Josh, I need you to look at me. I got right in. You know, I didn't have to go through all of these different appointments with other doctors, and we got right to work. And you know, you worked with me super closely for a couple months, and not only got me back better, but you know, and I share this often. I wasn't squatting for probably 4 or 5 years. I've had 2 low back surgeries. I start working with Josh, and now you know I'm getting under 3 plates,
yeah,
doing it for reps. You know, with great form, by the way.
yeah,
Just so you know,
yeah.
coach.
Trust me, I check his form, and it's pretty good.
Yeah.
Um, but your story and how we started working together is a very interesting one because, like you said, you were prepping for a show, and you were dealing with these pains and injuries that you were kind of just trying to push through, right?
Mm-hmm.
And that first session that we sat down and I started talking to you, diving a little bit deeper and taking the time to actually hear you out and kind of go through your history. Um, I had a couple red flags, and I was like, "This doesn't sound right."
Mm-hmm.
You know, you were talking about your knee and having to have meniscal surgery, right?
Mm-hmm.
Because you had a torn meniscus,
Mm-hmm.
and everything that I did, testing wise, movement pattern wise, your range of motion, everything didn't add up to a meniscal tear,
Mm-hmm.
right? And these are things that we learn in physical therapy school to kind of go through and assess. So when I asked you about your MRI results, right, that you had, that you kind of talked to an orthopedic surgeon about, um, you said, "Yeah, I have them. I can bring them to you." So our next follow up session, you brought the MRI report, and I started reading through it, and it clicked in my head that it wasn't a meniscal tear,
Mm-hmm.
right? It was just the simple fact that you were putting so much load on your body. You were so focused on pushing weight and not correct form,
Mm-hmm.
proper muscle recruitment, that we had a patella issue,
Mm-hmm.
right? Your knee alignment wasn't proper, and you were getting this medial pain that kind of mimicked the diagnosis or the symptomology of a meniscal tear. The MRI report didn't show one, and I showed that to you on that report.
Yeah.
And that's the reality of our medical system, right? They don't take the time to actually dive deep. And if it wasn't for you coming to step into my office, your plans were to push through, get to the show, get on stage, and then go in for a surgical repair
Yeah.
that could have been detrimental to you down the road.
Yeah.
10 years, 15 years down the road, you're getting arthritic changes because of that trauma that you experienced during that surgery, right?
Yeah.
Now look at you. You're hack squatting 315 with
Yeah.
no issues,
Yeah.
knocking out 20 reps,
Yeah.
right? And it's the fact that a doctor of physical therapy was able to take his time, use all his knowledge and guidance and say, listen, let's take a more conservative approach to this. Let's look at certain things,
Yeah.
being it biomechanics, muscle recruitment, compensation patterns, and let's see if we can give you the alleviation in the knee for you to keep doing what you're doing and subside, like go away from taking that surgical route,
Yeah.
right? Which one, I saved you a ton of money.
Oh yeah.
Two, you're now not having any knee issues, your hip
Performing better.
issues, your back issues are all gone. because of the guidance and tools and knowledge that I give you, right?
Yeah.
And that's kind of what Resiliency Physical Therapy's mission is to help provide that base of knowledge to each individual in the community to not have to go through unnecessary surgeries,
Yeah.
injections, or invasive treatments,
Yeah.
and get them better quicker so that they can get back to the lifestyle that they want to live.
Yeah. And I think that's where you see the two worlds converge of legacy health and wellness and resiliency, because we often share the same focus on the way that we deliver our care to our patients, and our common goal of, hey, the healthcare system's broken, we want to fix it. And this is our battle cry from the top of a mountain. So it's been really neat to see us be able to share patients with one another, and help them with their modalities, and also help them with their labs and their health and their nutrition. And you start to see a well-rounded person when they're able to have this level of care. And I think more importantly, less sick, less injury prone. You're giving them the tools to navigate through life. So what a blessing it is to be able to do this alongside
Yeah,
you,
of
man.
course. Our partnership and our relationship has been absolutely a blessing to not only my practice but the friendship that we've built. Um, a couple months ago, you guys sent me over a patient that was dealing with an Achilles tendinopathy, and you guys had him on a peptide. He was taking about 2 to 3 weeks, and it was kind of resolving some of the pain and inflammation that he was dealing with, but he was still not making the leaps and bounds that he wanted to make on that. So that's when you guys referred him over to me. We ran him through an evaluation assessment and said, "Hey, listen, like we can definitely help you with this." Um, and that patient has pushed my boundaries and has given me the opportunity to educate myself on something that I've never done, which has been a blessing to kind of dive deep into a sport that he does on a recreational basis, that has allowed me to learn a little bit about disc golf. Right?
Yeah.
But in that 12-week process of working with him, being on the peptides that you put him on, I really started to see the benefits and the collaboration that we could have, where he felt better with pain and discomfort in the area, which allowed us to kind of load those tissues up a little bit more, increase his range of motion, build up some strength. And within 10 weeks, um, he was back to playing disc golf with no problems,
That's awesome.
being able to push off that back leg and be able to throw his driver down the field 300 yards with no issues, no
Mm-hmm.
pain. Um, he enjoyed the process so much so that now he's coming in for a shoulder issue with me.
Yeah.
Um, so that journey and being able to bounce referrals
Yeah.
back and forth to each other, um, has been a true blessing, where not only am I able to tailor programmings for each individual to help them get better faster and quicker because of the time that I get to spend with them in my practice, but now I have the help of Legacy Health and Wellness with some of the peptide therapies that you guys are doing, the stem cell exosome therapies that you guys just got approved for,
Yeah.
which I'm excited about. Um, it just gives me so much more leverage and tools in my toolbox to help get my patients better and quicker and get them back to the things that they love.
Absolutely, man. And yeah, I mean, the exosome therapy, the PRP, those things that we're doing now, super excited. And, one thing that's been important for Legacy is anytime that we deliver something new, we want to make sure that it's being done at the absolute highest standard. And so having Dr. Josh walk alongside our patients post some of these treatments, it's really going to make a difference in how they recover. And there's a lot of science that supports having a physical therapist walk beside you during that time after getting these injections really increases the efficacy of the
Yeah,
procedure.
absolutely. You're going in for a therapy that you're investing into, right? And to make sure that you're doing it properly and getting the most education out of it and knowledge to make sure that that intervention holds and lasts and actually is successful is key.
Yeah.
So with the exosome therapy stem cells that you guys are implementing in your clinic, it kind of sparked an interest in my practice, where started to dive a little bit deeper,
Mhm.
seeing if there was any physical therapists out there in the US that were kind of diving into peptides and stem cells exosome therapy. And through my studies and research, I started to come across a couple of doctors of physical therapy that were doing that, and listening to them,
Mhm.
reading up on some literature. It really does make a difference having a doctor of physical therapy walk you through the process to help educate you on the tissue healing process, right? A surgical intervention, it's repairing tissues, and there's a step-by-step process of how that occurs over the
Mhm.
weeks that follow that intervention. And from listening to some podcasts and reading up on some of the research, it's the same process with the stem cells,
Yeah.
right? It's tissue repair, tissue layering, and healing that needs a rehab process. Sometimes people don't have that, and they go to the gym, they go
They
back
feel
to their
good.
activity, they
Yeah.
feel good, they're
Yeah.
like, oh man, I'm feeling great. Let me go back to my normal activities, and that tissue's not prepared for that.
Mhm.
So having a doctor of physical therapy walk you through that process alongside Legacy Health and Wellness when you guys administer that, um, it's going to be so much more beneficial for
Yeah.
your clients to make sure that their investment is one that's going to last and be successful. So I'm excited for that partnership.
Yeah, absolutely. So, exciting about all the different therapies and interventions that we're able to offer together. Can you share some of the most like common injuries you see? I know like in bodybuilding, we see a lot of injuries with incline bench press, and the shoulder. Obviously, with squats, the knees. But what are some things that you see a lot in your practice?
So currently in my practice, I am running some marketing campaigns specifically tailored to runners
Hmm.
and shoulders. So I see a lot of shoulder injuries. Being that I'm a overhead athlete from my background from Olympic lifting, CrossFit, I really truly love working with that exercise type.
Hmm.
So the bench press, the overhead press, pushing, pulling. So I see a lot of shoulder injuries. Runners is another great one that I actually truly love working with, for the simple fact that runners, all they're focused on is the miles on the pavement,
Yeah.
right? Putting miles in and just going out for runs. And a lot of times that is what's causing them the injuries that they're dealing with. So a lot of knee problems, a lot of ankle problems, hip, back issues, because they don't have a good strength and conditioning program
Right.
tailored to their running styles, right? Or the mileage that they're putting in on their bodies. So those are kind of the common injuries that I'm seeing: some knees, hips, backs, shoulders, um, and it's more of the athletic, active individual population. So they're dealing with some kind of pain or discomfort that are limiting them in doing their sport, their activity. So it's really awesome to see an individual come in with that problem and kind of helping them work through it and giving the knowledge base to push their limits and get back to where they were, and then beyond that with working in my clinic. So yeah, those are the most common injuries that I'm dealing with right now.
And if you could give advice to the people watching at home, two or three things that you'd recommend to prevent them from having to come see you, probably like self-sabotaging for your business, right? But at the same time, what are some of those things that people can kind of be cognizant of?
So life gets in the way, right? We all have an active lifestyle. We all have responsibilities from work, kids, family. So it's understandable that there's not going to be a great time period there for somebody to invest in their health,
Mhm.
right? Um, America is very sedentary, right? The obesity rate, it's up there, right?
Mhm.
So the advice that I would give somebody is just being active, right? Just going for a walk, uh, 2 to 3 times a week
Yeah.
is sufficient enough to just get some movement in, right? And starting there, right? Just starting nice and slow so that they can kind of introduce movement to their lifestyle. exercising 2 to 3 times a week with weights, right? A good strength training program, lifting.
Mm-hmm.
As we age, our muscle mass starts to decrease, and
Bone density as well,
bone
right
density
now.
starts to go as well. And our female population, they're more prone to osteoporosis and bone density issues as they age. So having a good strength training program now is like putting money in the bank for retirement, right?
Yeah.
Um, so that would be another recommendation. And then posture, right? A lot of the times we're so focused on being on the computer, our phones,
Yeah.
and that can start to cause a lot of issues, right? With bone structures, your spinal structures, the curvature of your spine. Um, so that can start to lead to some pain, discomfort, muscle tightness,
Mm-hmm.
weakness, and causing you those pains and aches that you start to notice as we age. So being aware of your posture um, and having a good strength training program can help with that as well, right? That we're able to hold our bodies in a good
Yeah.
position, right? So I think those three things would be my recommendation: some type of form of movement, posture awareness, right? A strengthening
Mm-hmm.
conditioning program, and maybe some stretching and mobility.
Yeah, I was gonna say, so stretching, and this is so funny. I get asked this as a coach all the time. How do I stretch before I train? Do I stretch after I train? Is there a level of stretching that takes place? What is your philosophy on stretching, specifically for, let's say, folks that are probably getting after it 4 to 5 times a week?
Yeah, so that's a really loaded question.
Yeah, yeah.
There's a lot of science behind it. There's a lot of research that goes into a stretching, mobility, flexibility routine. But there is benefit to stretching and mobility. Um, there's different types of stretching and mobility. So you have dynamic and static. So there's certain points of a workout that you should be doing some of those things. My recommendation would be looking at more of a dynamic stretch as a warm up
Mm-hmm.
prior to lifting or activities in sport. And then afterwards, post recovery, going into more of a static stretch where we're holding it for a longer period of time. There's research out there that shows that static stretching prior to an activity actually decreases your performance, power output, strength, things like that. So that's why I would recommend somebody to do a dynamic stretch in the beginning and kind of just getting blood flow, warm up, get those tissues primed and ready
Yeah.
for this sport specific activity that you're about to do, and then a static stretch with mobility and flexibility worked in afterwards on a recovery style basis.
Well, I'm glad to hear I'm doing it right.
I
I
mean,
don't have an option, right?
I am your doctor of physical therapy. I hope
Yeah,
I
right.
educated you right on that.
Tell me a little bit about your thoughts on contrast therapy. So that's been huge. We're hearing a lot about that, social media and the
Yeah.
news. What are your thoughts on it?
So the contrast therapy, it is a newer hot topic, right? A lot of people are doing it, and you see it on social media. But there is some research backing that as well, where it is beneficial for the individual to kind of go through that cold plunge and heat. There's different properties that are at play there, where a cold plunge is releasing a certain type of protein that helps speed up the recovery process, right? But some people are doing it wrong, where they're doing it right after their activity, right? They get done with their workout and they go and hit a cold plunge right afterwards, and that actually is having a negative effect on your muscle recovery, your muscle strength, and what you just put in during that exercise routine, right? You put in all that work, and then all of a sudden you're slowing down that
Yeah.
recovery process, the strength building, the muscle building there. So there is a lot of nuances and things that you got to pay attention to when you're doing those contrast therapies, and making sure that you're timing it right and appropriately, so that you're getting the best benefit from it.
Yeah.
There is, evidence that shows better sleep quality, better cognitive function with cold plunge and contrast therapy. The benefits of sauna or red light sauna therapy, you're kind of sweating out some toxins, and increasing your body temperature, which releases another type of protein reaction in your
Yeah.
body that helps with recovery and sleep, metabolism, things like that. So there is some benefit to it, but you got to make sure that you're doing it right and doing it at the
Yeah.
appropriate times to get the full bang for your buck.
Yeah. No, absolutely. So, when it comes to picking a DPT, what are some questions you think that every person should be asking when they're kind of going through that interview process? I mean, hopefully they all
Yeah,
come to resiliency, but if they don't,
yeah.
what should they be looking
It,
for?
it it's all dependent on the individual, right? Um, if you are just trying to get out of pain and get that relief, then a traditional physical therapy practice might be beneficial, right? If you have really good insurance, it's understandable. Yeah, but understand that the quality of care isn't going to be something as great as going to a cash physical therapy practice where they can spend the time
Yeah.
to dive a little bit deeper. Some of the questions that I would probably ask, and this is this is going to go against the grain, and a lot of people aren't going to probably like this, is what type of physical therapy are you guys implementing in your practice? So if they say, oh, we do ultrasound, we do modalities, we do heating pads, cryotherapy, things like that, then that's the type of physical therapy clinic that you probably should shy away from, right?
Mhm.
Um, you need somebody that's going to look at movement patterns, actually load the tissues that are causing you some pain and discomfort. Um, More exercise and movement based physical therapist, um, because that's what you need,
Yeah.
right? You need to move your body. Our bodies are made to move. That's what God intended. It is like the system itself is movement, right? We're supposed to walk from a young age, crawl, all these things that we did as kids, tumble, run. That's what we should be
Yeah.
doing. And that's the type of physical therapy clinic that you should be looking out for, is a clinic that's very movement based, that's going to have you exercise and not just treat you with modalities and things like that.
So Josh, as we close out here, man, a couple questions for you, and then want to let everybody at home know how to find you. So, one, when it's all said and done and the dust settles, what is the impact that you would resiliency want to leave on the community that you serve?
Yeah, so I think the impact of resiliency physical therapy that I want to leave is truly, no pun intended, a legacy of community help, community outreach, and helping each individual understand that physical therapy is more than just getting you out of pain and discomfort. It can definitely change your life. And the fact that we can optimize your performance, we can get you to your retirement age feeling healthy, feeling strong, feeling good, and being able to leave that lasting impact in my community is truly what I want to do. And I want to be able to look back on my career and say I not only left that impact on the community, but I changed and I was a part of advancing physical therapy, um, the practice, helping other clinicians find that passion again for physical therapy, and be able to leave that lasting impact is basically my life's mission. If I could help individuals not have to go through unnecessary surgeries, injections, and waste money on these invasive treatment sessions, or those types of treatments that truly can sometimes just be a band-aid for the issue that they're dealing with, um, then that would make me happy.
That's awesome,
So,
man. What's your why? What's your driving force?
ooh, that's a good question. So my why, I believe my why is my family, my wife, my beautiful daughter Antonella, um, being able to see them happy, um, being able to provide them a good quality of life, um, and then being able to see the smiles and the small little wins every day with my patients is super, super impactful on me, right? Um, Getting to see somebody complete a marathon when they thought that all the hard work and training was wasted because of an injury that they're dealing with, and being able to see them complete that race is awesome.
Yeah.
Seeing a father be able to pick up their kid again because we worked through some back issues and give them some strengthening for their back issue, for them to be able to pick up their kid again and be able to enjoy that without any pain, and for them to come and say, thank you so much, you gave this back to me. That's awesome. So I think that's also part of my why.
I love that, man. And lastly, when you are not being a physical therapist and you're not working in your craft, what does a fun weekend or a fun day off look like for you?
Honestly, right now, playing with my 1-year-old daughter.
Yeah.
Um, Having a kid changes your whole life and your perspective on your views, and it consumes your time outside of the practice. I'm there helping my wife with her and playing with her, and those sleepless nights.
Yeah.
But that's probably my weekend, right? Spending time with the family, going and enjoying a good meal at a nice restaurant, watching a good movie on Netflix, um, and just enjoying the process and enjoying life, and that's probably what I'm doing on the weekend. It's
Yeah.
just taking it all in
Yep.
and seeing where I'm at, enjoying my family, and just taking it one day at a time.
That's awesome, man. I'm hoping that, at the conclusion of prep, I can join you at one of those really nice restaurants and be a foodie with you guys.
Yeah.
I also enjoy food when I'm not suffering.
I know this really good steakhouse in St. Pete that we need to go to.
There we go. All
So
right, we'll
get a
make it
nice
happen.
juicy steak,
Yeah.
some really good
Oh,
food.
let's
So,
go. So, tell the people, where can they find
Yeah, of
you?
course.
How do we get in contact with
Yeah.
Resiliency?
So you can go to my website, resiliencypt.com, or you could go to my Instagram handle, resiliency_DPT. That's where you can reach out to me on the website. You could book a 20-minute discovery call so that we can kind of discuss what's going on and how we can help.
Awesome. Perfect, man.
Yeah.
Well, listen, thank you so much for all you
man.
do. It's a pleasure to partner with
Always.
you, and let's continue to change some lives together, man.
Definitely.
All right.
Awesome.